right, so this patient, a lot of people really like this before and after, so I'll tell you some of the measurements on this one. If you're a surgeon and you're watching this, don't try and repeat what I do, not because you can't do it, but it won't apply to the patient that's sitting in front of you, okay? This isn't cooking class. Anyhow, for this patient, she wanted a crease that was visible, but still natural, followed the shape of her eyes, and gave her the ability to be able to see the crease, plus lashes, makeup, that sort of thing. So in this particular case, we're really not taking out much skin, maybe just a few millimeters for laxity's sake. And the actual anchoring point for her after her ptosis repair, which was a levator advancement, like a lot of the ptosis repairs that are done in this world, the levator tendon itself was only moved forward a few millimeters attached to the tarsus, and the anchoring point for her crease was not, I swear to God, they're just going to slam those doors no matter what. Anyways, so the anchoring point for her was not 7 millimeters like everybody seems to think. When patients come in, they're always asking me about 7 mm, 7 mm, 7 mm. For her, it wasn't. It was wildly different. It was 6.5. So, how's that? Take that, Google. Anyways, so did anchoring technique when we were closing the skin at 6.5 millimeters. We advanced her levator tendon on the inside, just 2 millimeters. And we made a parallel crease, but one that followed the shape of her eye, so it still looked natural. So, hope you like that one. I'm Dr. Chase Lay. Thank you so much. Have a good day. We're shooting here.